Good morning and welcome to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. I'll be sitting in for the ride this morning. Good morning, Dr. Flaharty.
Good morning, Gina.
So we're going to spend the next hour, if you're new to the show, talking about ways to look and feel your best. Now, Dr. Flaharty is the expert when it comes to faces. He is one of the production. He is the founder, the medical director of Azul Cosmetic Surgery. There are three of them: Fort Myers, Naples, and Bonita Springs.
Yes, right.
So you're quite a busy man, going back and forth between the three of them.
Indeed, yes.
And I know over the about all of the great technology and the new things that people can do to stave off going the full Monty and having a facelift. There's so many things to turn back the hands of times. But we always mention facelift. That's the goal. That's the thing out in the shiny object out in the sky, which is the ultimate when you're aging to really change. You said you wanted to talk about facelifts this morning because we always throw that term around a lot, and it means different things to different people, and a lot of people have a perception facelifts are and when they need them, and so we're gonna get to the bottom of it this morning.
Yeah. So I kind of titled it "What is a Facelift?" and I think it's important is that facelifts have evolved a lot over the years, from early days of very sort of crude ways of just sort of tightening the face and neck to very sophisticated procedures that we have today. And you know, I laugh because when I was kind of writing up some notes for this, you know, there is as many different facelift techniques as there are surgeons doing facelifts because you know, everybody will wrinkle or their own little nuance. But, you know, there's some general trends that have taken place 10, 20 years in terms of the way things are done. And I think it's helpful to, you know, facelift has a good and a bad stigma face. At the same time, you know, a lot of people are like, well, I want to do something to look better, but I don't want a facelift. You know, they're just, you know, they're psychologically opposed to that concept because it just carries some kind of weight that's in some way a negative, or they feel like maybe I shouldn't be ready for that. I'm too young for that. When the reality is that, you know, these are just, facelift is really a set of surgical procedures, a number of different techniques that can be employed to help you look better. And, you know, in general, facelifts, and we'll get into the more details of what's an upper facelift, what's a lower facelift, what's a mini lift, what's a full lift, what's a neck lift versus a face and neck lift, because these are all terms that get thrown around and are very confusing to people. And so trying to clarify them is important. But, you know, facelifts are really the gold standard in many ways in terms of long-term rejuvenation. We're talking about reshaping the face. It is true we have more and more technologies and more treatments we can do non-surgically, and those are growing in popularity. Things like fillers and lasers to tighten the skin and eliminate brown spots and wrinkles, and skincare technologies. And that's great because there's so much more we can do without surgery. But at the end of the day, there are certain things that we can't fix non-surgically. And you know, that's where things like eyelid surgery and facelifts come into play, because they give us, you know, a really meaningful long-term improvement and rejuvenation with a single procedure. And that's what makes them so powerful. Right.
And when we talk about facelifts too, and you were talking about perceptions that a lot of people say, gosh, I'm not that makes me feel like I'm old if I have to have a facelift. And maybe some of the people who are older think, gosh, I've seen so many people, they just, I guess different generations have different stigmas when it comes to the facelift too. Do you find that, or?
Yeah, I think so. And I think people are more open to that now, and it's a little bit less, but still it exists. You know, I mean, I see this all the time. People will come in and we'll start talking about their history, and they'll say, well, I had this little mini tuck a few years ago, or 10 years ago, or 20 years ago. And then I'll look at them and, you know, examine them, and, you know, they've had a full face and neck lift, but in their mind, they haven't had a full face and neck lift, you know, because whatever it is that, you know, prevented them from thinking about it in a clear way. It was just that. And the same thing, you know, we'll go through to talking to the patient about, okay, here's the best option. I'll walk through that, and they'll go, oh, well, that's not a full facelift, is it? You know, because again, I don't know what that is. I guess it's just,
an admission that you're not perfect.
Yeah,
I mean, really, to
maybe,
get down,
or maybe the perception that that's something that I would never do. You know, I might do some things to make myself look better, but I'm never going to do a full facelift or something. And so, you know, for some people, maybe it's palatable to say, oh, well, I did more of a mini lift or something. But the reality is, again, with a full face and neck lift, for example, which we call lower face and neck lift, you know, the results are really unparalleled. There's nothing else. We you know, employ a lot of technology, you know, Ultherapy, Sclerotherapy and radiofrequency and these ultrasound technologies and all the devices that we can use to tighten and reduce fat non-surgically. And they're great. They're very useful and they can do wonderful things, but they can't replace what you can accomplish with a surgical face and neck lift. And again, this is part of demystifying it. What is it? How does it work? What's involved with it? And those types of questions are important, because I think once people totally understand how it works, they're generally very excited about it. People who have them often go, wow, if I knew that was that easy, I would have done it years ago. And it's very doable with a minimal of downtime and great long-term results. And that's the good news. Your mother's facelift isn't the facelift of today. Right. You know what I mean? The technology's gotten better. The anesthesia's gotten better. Our understanding of anatomy, the techniques are better. And so people get better results with less downtime, and that's important.
And the other thing when we were talking about facelifts and perceptions, before we, really get into the nitty gritty of it, is that you don't have to be 70 or 80 or, a lot of people are getting them in their 50s and younger because your skin's better. You can kind of stop the aging process sooner, like you said. And so what are some of the youngest and the oldest? What is the age range that you see come in here?
Yeah, I mean, I've seen patients for mini lifts in their 30s. And, that's maybe a little bit of a genetic issue where they get some laxity of the skin at an early age. I think 40s is more and more common, and certainly 50s. 40s might be mini lifts, a combination of mini lifts and full face and neck lifts. And then 50s is sort of, in my opinion, they're sort of the ideal age. You're healthy, you've got good skin, you've got good bone structure. Most of the time you have a fair amount of fat still in the face. You're not overly hollow yet. And those are things we can address with other procedures. But 50s are very popular and 60s are too. Now, that said, we see patients now coming in their 70s and even 80s for primary facelifts, which is, I think they get to a point where it's like, geez, I'm healthy, I'm doing well. I've raised my kids, I've raised my grandkids, and, why not? Right. I think they sort of go over the economics of having a facelift and they want to look better because they're active and doing things, and the face they see in the mirror isn't the way they feel, and they're much younger in spirit and in activity than they are in the way they look. And so it's been interesting to see this evolution of patients both older and younger coming in. I think the age range has widened because I think younger people are more willing to do things that perhaps previous generations wouldn't have done as frequent. And same thing with older folks. People are living longer and staying healthier. So 70 isn't 70 anymore. I mean, that's the big difference there. Even in my career 20 years ago compared to now, I see a lot more patients 70 and older who are coming in for rejuvenation procedures, which wasn't as common, 10 and 20 years ago.
So when somebody is considering this and they they come in for a consultation and we decide to go all the way, how do you help get them prepared for a facelift and the timing? I mean, what are the things that we need to consider once we say, okay, I'm 40 and I don't like the laxity in my jaws, or I'm 60 and I sure enough don't like what's happening with my face. So for those age ranges, how do we, for someone listening right now thinking about it, let's look at what the other considerations. So I've decided I want it.
Yeah. So first of all, I guess one of the things I want to do is sort of define facelift. And as I mentioned, there's lots of variations on a theme, and that's where it gets very, very confusing. A lot of different terms people use for facelifts. But I think generally, it's any procedure that we're using to lift, tighten, or resuspend the tissues of the face. And so that can be the brow. That's, lifting the brow is a facelift. It's an upper facelift. Or lower face and neck, or even mid-face. You can do what's called mid-face lifting, is lifting the cheeks. Interestingly, that's a procedure that isn't being done as frequently anymore because we find much of the aging of the cheek in the mid-face is from volume loss, and we can replace volume non-surgically with fillers or fat augmentation. And so that's an area where technology and understanding and some of the new tools have really changed a procedure for the better. So rather than releasing and lifting the whole cheek area, we now are just filling it and lifting it through adding volume, and that's a huge improvement from a patient perspective, because those injections can be done in the office, and they're quite simple with, really no downtime and really great results in terms of reshaping the face. And in the end of the day, all the things we do are really an attempt to reshape the face to a more youthful shape. It's not really a matter of trying to make things tight or stretched at all. It's really trying to create a youthful shape to the face. But in that sense, there are times when lifting is necessary, as we mentioned before on this show, like heavy eyelids. At some point you can't fix that any other way. You have to just remove some of the extra skin or sculpt out some of the fat. Same thing with a heavy brow. If it's loose and heavy, then lifting the forehead is the way to help rejuvenate that area these are easy things to do in the mirror. You just kind of reposition the tissue of the face and see what looks good, and you can often see that if you lift your brow, it looks better. If you lift your lower face and neck, it looks better. And then lower face and neck is sort of the lower face lift. So lifting the forehead or brow would be considered an upper face lift. Lifting the lower face and neck would be a lower face lift. Mid face lift would be a term applied to lifting sort of the cheeks only. And as I mentioned, that's a procedure that isn't done surgically as much, because it's really being done with volume now, which is easier. So that's been a big step forward.
Okay. So we've got a lot of area of the face to cover here. And thank you for defining, those, because, like you said, people listening, like, I don't know, what's the upper, what's the mid, because we don't hear about the mid as much anymore thanks to fillers and that type of thing. Well, let's take a quick break here. And when we come back, let's dive in a little bit deeper and want to start on the upper
Yeah, let's do that. That'd be great.
Okay.
That'd be great.
You are listening to Look and Feel Your Best. If you want to get online, by the way, azulbeauty.com is the website. I sometimes forget to tell people that website, so I'm going to do it while it's on my forefront. All right, we'll be right back with more of Look and Feel Your Best in just a few minutes. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch, and this morning we are defining the term facelift and what it is. And I don't want to just say defining, but we're delving into it and helping people understand a little more, because, as you said, Dr. Flaharty, a lot of people have a stigma attached to the name, or they just really don't understand. They have different perception of what a facelift is, and you kind of gave us a nice overview in the last segment. So let's talk then about the upper part of the facelift.
Yeah, so an upper facelift is really a forehead lift or a brow lift, and those are the terms you more commonly hear, like a brow lift or a forehead lift. But when you think about it, if you're repositioning the forehead, that's really the upper third of the face. So, you could call that an upper facelift. The good news is, this is a procedure that has evolved tremendously in the last 20 years. I now do all my upper brow lifts or forehead lifts endoscopically, which is the newest technology and the best technology for that. And so what that means is you can make very tiny incisions in the hair-bearing scalp, just 4 small little incisions that are about 1 centimeter long. And through those incisions, you can actually release the forehead, which means you're not opening up the tissue. You're not making a big incision and lifting the skin. You're really just going, using these access points to free up the tissue. And you can release the brow on the inside with very delicate instruments and with the aid of an endoscope. So an endoscope is a long tubular instrument that has a camera on it, and that allows us to see inside. So see inside the forehead, and we can go down and release the brow. There's certain areas and tissues that need to be released across the brow, so right under your eyebrow and at the bridge of the nose and down kind of along the lateral part of the eye, what we call the lateral orbital rim. You can even go down into the cheeks and mid-face and combine this to a mid-face lift, but releasing the brow is done very delicately so that the forehead is free, and then you can just sort of slide it up. The brow just easily lifts, and we have special little device that's really great technology called an endotine, and it attaches to the bone, and you create a small little hole in the bone. It pops in. One end is like fits perfectly into the hole you make, and then the other end are small little pegs that will hold the brow up from the inside, and so you can lift the brow. And we use one of these on each side, so one on the right side, one on the left side, and once you've released the brow and kind of slid it up, you can attach it to these endotines, and that will hold the brow in place. And that allows us to not only lift, but shape the brow. And so that's what's called a forehead lift, an endoscopic forehead lift. With that procedure, we're not taking out any skin.
That's the key with this, because a lot of people say, I don't want a line on my forehead,
right,
even if it's at my hairline, where people can say, oh, you've had skin removed.
Right.
And that's what I think is so cool. It's like you take care of the skin as a whole different thing. You go underneath and you tighten everything. So then you're not pulled and looked fake or stretched, because you're going deep to a deeper level.
Right, at a deep level. So it preserves the skin, the subcutaneous fat, the muscle, because you're going deep to all that. So the animation of the forehead stays the same.
Great.
The tissue looks very natural because you're doing really a composite lift of that entire tissue. And that's sort of the key. So what we're really doing is lifting and reshaping the brow. And as you mentioned, opposed to older brow lift techniques, which were large incisions that were hidden either in the front of the hairline or behind the hairline. But it's the problem with the large incisions is you're making big incisions. That's affecting the hair. You're going to get numbness guaranteed from that because you're cutting through a lot of sensory nerves, and there's a lot of wound healing that takes place. And it's a bigger procedure, and there's a much longer recovery, and there's more more stigma, more what we call morbidity, because you do have these larger incisions that have to heal and all that. So it really wasn't a very attractive procedure when you explain and early in my career we did a lot of open brow lifts before the endoscopic technique became to the fore. And people generally, when you would describe it to them, mostly would say no thanks. I'll live with my heavy brow.
Right.
But, an endoscopic brow is done in a third the time, very small incisions. They're closed with a simple dissolvable stitch, and you never can see those incisions even the week after. I mean, you don't those stitches just fall out because there's no tension on the wound, because again, the lifting is done at a deep level, and the suspension is done with these endotines, which are attached to the bone. So it's sort of the perfect fixation. You're not trying to just tighten the skin or lift the skin. You're just repositioning the skin with the muscle, with the fat, with the entire forehead, and reshaping it. And so you get a very natural result with that, which is really great.
So, and then when you're doing that, it's also important, you said you get that natural result, is you don't want to pull it too tight in different areas to change the way the brow looks. Like, give me a bigger arch, unless I say, hey, Dr. Flaharty, I want more arch. And men and women are different. So this is a very, it's very subtle, and it's very, I don't want to say artistic, but it kind of is, because you are an artist reshaping the face, or keeping it the same but making it better.
Yeah, it is definitely artistic. Yeah, and there's a lot of artistic judgment that goes into that. That's pretty much of all of facial surgery. Even when we're doing fillers, there's an important artistic element to what we're doing if we're changing volume or changing shape. And that's especially true in the eyebrow. If you've ever seen the little smiley faces with different brow positions, it's kind of a fun little one, an angry brow, a sad brow. But that's how we age. I mean, everybody's a little different. Some people develop more sagging in the inner part of the brow, kind of the inside of the eyebrows. That makes us look very scowly or angry. If the outer brow drops more, that tends to make us look very tired or sad. And so these are the consequences of aging. And so when we reposition the brow, obviously we spend a lot of time with the patient looking at the various shapes and contours and determining what's the best contour for the long term for that patient. And that's really what it is. It's a lot of reshaping of the brow to take away the sad brow appearance, or the tired brow appearance, or the angry brow appearance, and achieve a more youthful, kind of happy brow appearance, which is good. Yeah.
Now, and I know eyes are a whole different subject. So if somebody says, well, why aren't you talking about the eyes? I mean, you can do those independently of a facelift or with a facelift, right? I mean, that doesn't have to all...
Right.
Sometimes the brow lift fixes whatever problems you have with it, or improves. Maybe not fixes, but makes it better. Right.
So eyelids can be done with brow lifts, of course. When we do a brow lift, that does help the upper eyelids significantly, because as the brow drops, there's what's called the brow fat pad, which is this thick fat pad that rests right underneath our eyebrow. You can feel it if you pinch your eyebrow. There's just kind of a spongy pad there. When that drops into the eyelids, it makes the eyelids look very heavy. When you reposition that, And that's the most important part of a brow lift, is the repositioning of that brow fat pad, because that gives you that really nice shape to the brow. Then it takes a lot of that loose skin out of the eyelid and rejuvenates the eyelid. And sometimes people will have so much loose skin in the eyelid that they'll still need skin removed, and sometimes not. Sometimes they won't need the skin removed. So, that's a determination we make when we evaluate patients. So certainly you can do the upper lid and certainly lower lid as well at the same time of a brow lift. But many times if we're doing a brow lift, we don't need to do the upper eyelid because it corrects that so much.
Okay.
If people have a heavy brow, it'll show up as a heavy eyelid. Once the brow is corrected, that heavy eyelid is corrected to a large extent. So,
right.
It's really nice.
All right. You get a 2-for-1 with that one.
Right.
Okay, then moving down the face a little bit before we take a break, let's go ahead and jump into the lower facelift and when you're looking at a person and, what is involved in the lower part.
Well, before we do that, let's talk a little bit about the shape of the brow, just in terms, you kind of have touched on that, but just a little bit more thoroughly. So, for women's brows are different than men's, and if you look at model pictures, you'll see women tend to have this arch brow. It can be low, it can be medium, or it can be high. That's different from one person to another. Men, however, do not generally have an arch brow. They more have a flat brow. So the shape of the brow is really important, and it's very different between men and women. So in a man, when we do a brow lift, we want to lift the brow but keep it flat, so it can be higher but not arched. That's really important, because a male brow tends to be a heavier lower brow and flat across, not arched. So that's a key thing. And with the endotines and the endoscopic approach, you can nicely lift the brow without changing the shape of the brow or maintaining a masculine shape by where we put the endotines and the suspension. In a woman, it's always some version of an arched brow based on, their anatomy and how they're built and what their ideal shape is, which we determine preoperatively by discussing and looking at the different options. But at the end of the day, generally it's going to be more of an arched brow, and so we're lifting more laterally the brow to give them that arched brow and get that brow fat pad up on the brow bone and get that nice convexity, which is that area. If the brow is lifted to the ideal position, you can see the brow bone underneath the brow. It gives you this nice concavity or convexity that is really the bone right underneath the brow, the orbital bone, and that's a really pretty aesthetic feature. And so for women, we're trying to recreate that youthful shape to the brow by lifting more the lateral brow than the inner brow. And so those are really key things. And with that technique, these small incisions and using the endotines, we have really exquisite control over the height, shape, and contour of the brow. In fact, once we do the lift and do the fixation, I sit the patient up and I look at the height, shape, and contour, and then we can adjust up or down if we want to, and making sure the symmetry is good to get the result we're looking for. And it has a really, really, really high accuracy rate in terms of achieving exactly what we're achieving. So it's made a huge difference. Not only is it small incisions, no skin removed, quicker procedure with less downtime and less discomfort, but a much more accurate and longer lasting procedure.
Right. So you have the canvas in front of you, the patient, so you see what they look like. But do you often say, hey, bring in a picture that you really felt good and you liked how you look? Because then you can kind of see a little more the shape, how it was maybe 15, 20 years ago.
Yes, that's really helpful. And I have everybody do that. And that's especially helpful with fat augmentation, where we're adding volume back to the face to create a more youthful shape, because we want to see where they came from.
Right.
We see where they're at today, but we don't know what they look like 20 years ago, 30 years ago. And so those photos can be extremely helpful in seeing, what did they look like when they were 20, and trying to recreate that when we do these procedures.
Right, because you don't want to make them look different. As you said, you want to make them look like a better them, or more youthful.
Right,
person.
More youthful and a natural
yes.
refreshed, but not different. And that's what patients want. They want to look better. Right. They don't want to look different. They certainly don't want to look surgical, like they've had something.
No.
And these procedures can be done such that you look better and refreshed, but you don't look different, and nobody will know you've had anything done. What's really remarkable, you can do brow lift, face and neck lift, fat augmentation, and a comprehensive rejuvenation of the face, and make patients look 20 years younger, but nobody really will know they've had surgery because they don't see the pre-op picture. If you see the two pictures, you're like, whoa, that's a big difference. But when all those sort of blemishes are gone, people forget that they were ever there because you still look like you just look refreshed.
Perfect.
So it's a wonderful a wonderful thing now with the state of the art of rejuvenation.
Okay, let's take a break and we'll be back and tackle the lower facelift. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. What is a facelift? Really, what is it? I mean, we all have an idea of what it is, but everyone's idea is different. So that's what we're talking about this morning. We're going through perceptions, and Dr. Flaherty's just forget about the perceptions. This is what it is. You're giving us the medical
new reality,
lowdown.
New reality. So yeah, we talked about upper facelift, which is really brow lifting, and in my hands, endoscopic brow lifting almost exclusively. The old open brow lifts with large incisions are, there's still some indications for that, and there's certain circumstances, certain anatomic variations where you can use that where it makes sense, but very rarely, anymore, because the endoscopic lift is so much less invasive, so much more accurate, quicker, and works fantastic. And so that's the state of the art now, is endoscopic brow lift, which is really an upper facelift. So, that is considered a facelift, although we generally call it a brow lift or forehead lift.
Okay.
I think the lower face and neck lift is really kind of the term that most people associate with a facelift.
A facelift,
right?
I agree. Yeah, right. I would too. I would say, in my mind, if I hadn't known everything that I've learned with you over the year, that facelift to me would be neck and jaw.
Right. Yeah. But when you think about the term facelift, it's really lifting the tissues of the face. So a brow lift is a facelift. Sure. It's just an upper facelift, right? So, but lower face and neck lift is kind of the term most people would say, okay, yeah, that's what a facelift is. And, that obviously is addressing the laxity of the jawline and neck, which kind of occurs simultaneously. So lower face and neck lift are typically done together as a single procedure. Again, sometimes people come in and say, oh, I just want a facelift, I don't need a neck lift, or I want a neck lift and I don't need a facelift, but almost always they need both if they haven't had anything done before, So that really, so the upper facelift, the endoscopic brow, really tightens things from about the level of your eyes up.
Right.
And a lower facelift is really from that level down, including the cheeks, jowls, and neck area. And so that obviously addresses a big portion of the face and the areas that we tend to see a lot of laxity. If people have extra fat in the neck, then we can delicately take out that extra fat. That's a very safe procedure on the face. We're using very delicate cannulas and it's very delicate, recontouring of the neckline and jawline, and then lifting the tissues. And our understanding of anatomy has improved tremendously in the last 20 years, and so the techniques are now hidden incisions where we hide. Now in a lower face and neck lift, as opposed to a brow lift, we do need to take tissue out, almost always,
right?
Because at the end of the day, there is stretching and laxity, especially in the neck area. We get stretching of the skin, so you have too much skin, so you do need to remove skin at the end to get the kind of result. It's not a skin lift. We're not trying to tighten the face by tightening the skin. It's done at a much deeper level, but the consequences of it at the end point will be you've tightened the lower face and neck, you've recontoured and reshaped this face, and that's created a lot of loose skin because you have this redundant skin. So we typically do very hidden incisions that go inside your ear, so there's no line in front. That's really important. So there's no visible lines for people to see in front of the ear, and then it goes in the cleft behind your ear, sort of deep into that cleft. So again, nobody can see that, and then kind of hidden along the edge of the hairline, back behind the ear, along your neckline.
So there's nothing under the chin then? No.
There can be. It depends. In the evolution of this, there's less and less being done under the chin, but we will often make a small incision to do liposuction of the neck. That's about 0.5 centimeter and closes with one little stitch. There are occasionally cases where we have to do some direct fat removal under the chin or do some muscle tightening under the chin, and then we'll make about a 2 centimeter incision. But more and more we can do more of this from behind, which is better, because when you think about how your face ages, lower face and neck, it comes from, the ears forward. That's how it stretches. And so you're dropping with gravity. And so when you take your fingers and put them on the cheeks and neck and you lift up and back and you look in the mirror, you go, oh, wow, that looks good. I look younger, takes away all that looseness. And that's really how we age. And so you want to reverse that aging process. And so the majority of the vectors are to lift, superiorly and posteriorly to tighten and lift and reposition those tissues. And the key there is once you've done these hidden incisions, which is one really important point, so that there's no visible incision lines. And those are ultimately closed with dissolvable stitches that are about the color of, blonde hair. They blend in very naturally. So you really can't see them even from day one very much. But once all that skin is released, then you're going to do this deeper tightening. And that's the key to what you do under the skin, not what you do to the skin. And so we do a thorough tightening of the tissues. And again, based on the shape and changes of that particular patient's face, we may do some liposuction or direct fat removal. We're going to do some deep tightening. The muscles and fascial planes under the skin are really where the tightening should be done, because those are the areas that are most powerful for lifting and reshaping the face. And then once you've done all that work, then you just have, like as I mentioned, you've created this extra skin. And so you're just going to trim out the extra skin and close with very little tension. And again, the old facelift was a facelift where people would make a limited incision, undermine the skin a little bit, and then try to pull all the wrinkles out by tightening the skin as much as you can. And that would lead to visible scarring and stretching of the skin and all the, traditional stigma of having had a facelift.
Surprise.
Kind of thing. So that's avoidable with, good technique and understanding of anatomy. So we do, a more thorough release of the skin, a deeper tightening of the face. And then we've created this extra skin and we just trim that out and close that with minimal tension so that it looks very natural from day one, not stretched or overly tight. Perfect. And that's a key, so people can look good right away, day one. Okay.
So you also, we get rid of the fat, because people think, well, I don't have fat under my neck. I just got that wobbly skin. But a lot of people do get, there are two problems with the neck, right? That skin that hangs and then the fat that accumulates there.
Right. Yeah. We tend to get a little bit of extra fat under our chin and under our jawline at times. And so when it's excessive, then using the liposuction to trim that down is key, because that can give you a better jawline, a better neckline. So you're correct. I mean, tightening, once you've tightened the deeper layers, the muscle layers, then you're going to tighten the skin. But if there's extra fat, that creates some bulging or fullness or, a lack of definition of the neck. And so taking out some of that fat can thin the neck out and give you a better jawline and a smoother, longer neckline profile, which is kind of the key.
Right. I know you want to talk about how we work all of this in together. I'm going to go ahead and jump ahead to that, because we're looking at, you just told us about the upper facelift, and we're talking about the lower facelift. And there's something that they go together. Right. In other words, I know my neck maybe is not the best, and this is really what I want to fix. But then I get this fixed, and it's like, I always like to say, it's like now the carpet doesn't match the drapes, because I've got the heavy brow. I'm like, gosh, if I had just done it all at once and just if you correct one thing, in other words, the thing that you don't like is going to stand out even more on the rest of your face, correct?
Right, exactly. And that can be the case, and it often is the case. And so that's why for most of the patients, we will do lower face and neck lift with an endoscopic brow lift, because an endoscopic brow lift really is an upper facelift. So a common stigma of a facelift also is somebody that's had a lower face and neck lift, but not a brow lift, and they have looseness of the brow and forehead. And at what we call the crow's feet area, that's where the lower face and neck lift kind of stops. You see bunching or wrinkling or redundancy there. So you might have this beautiful jawline and neckline, and then you've got these heavy eyelids and this heavy brow, causing some hooding and tiredness and the bunching at the lateral canthal area, which is, the crow's feet. And so it doesn't look right. I mean, that's what now stands out as a problem. But when you do the endoscopic brow lift at the same time, then you've lifted all that tissue up. And so then it's what we call harmonious rejuvenation, so that it all blends together, because you don't want to tighten and rejuvenate one part of the face, make that look great, which would actually exacerbate the other part of the face. Obviously, those decisions are made very individually. We don't all age exactly the same. There are people where their brow will stay high and tight and they don't really need a brow lift, or vice versa. They may have just heavy brows and not a droopy, jawline or neckline. And so, obviously the preoperative evaluation, we look at all these areas. But in the cases where the brow, face, and neck are all kind of loose, it's way better to correct them all at once, and it's really not difficult to do. That's a very standard thing. You do the endoscopic brow lift, that's under an hour to do. A lower face and neck lift is typically 2 to 3 hours depending on what we're doing, and those are all done under IV sedation. You don't need general anesthesia. And so our typical day for us would be doing an endoscopic brow lift, perhaps eyelids, a lower face and neck lift, maybe some liposuction, fat augmentation to add volume to the face, and maybe even a laser to tighten the skin. And those things can all be done at once in one patient. And that's where the technology and techniques have improved so much. Things that we wouldn't have done together because we just didn't have the technology to do it, or do it in short enough time, now are things we can easily do.
It makes sense for so many reasons, because you want to look natural. Well, if I only have half of my face done and the rest looks old, then that's going to make me look unnatural.
Right.
Natural is everything blending together, like you said, harmonious rejuvenation.
Right.
The other thing that makes sense to me is, gosh, why don't I just have one downtime? Let's just do it once and get it all done. Then I don't have to take another 2 weeks off here and spend that extra money to go back under sedation again and have the facility. I mean, it seems like it would be less money and less time.
Yeah, you save time and you save money, but most importantly, you just look a lot better.
Right.
I mean, I think, when I'm looking at a face and we're talking about, and like you say, there's always touch points. People will come in and say, I hate my neck.
Right.
And that comes up a lot. But then you say, okay, once we fix that, then what does the face look like then? If there's heaviness of the lids, or a drooping brow, or wrinkles of the skin, or deflation where it's a really hollow face, it makes sense to correct those things at the same time if you can. Obviously these are very individualized. Our consultation process is very individualized. I will go over with the patient all the things we think that can help them and what the ideal would be, and then we go from there. And sometimes it's just one thing that bothers a patient, and if we can fix that one thing without creating this imbalance in the face, then that's great. But if it's going to create an impression up front, and so it's nice because in a perfect world, when you do that more comprehensive approach, and I started doing that really about, I guess it was about 15 years ago, right around 2000, we started doing everything sort of together. And the satisfaction rate just went way up because people, like as you mentioned, you still have some downtime. If we're doing the entire face, it's going to be a week to 2 weeks, but then everything is done and you look great. Rather than kind of like, oh, well, this part looks great, but now I think my eyes look heavy, or my brow looks heavy, or whatever you didn't do. And so you don't have to do it all at once, but you want to do the procedures that are going to give you a natural result and, the best rejuvenation. And so, the happiest patients and I think the best results are when we do a more comprehensive approach, because nothing is left undone. It all blends in and you're pretty much done with surgery at that point. Then you're just going to do maintenance things like skin care, maybe Botox and fillers. And that's nice to know too, that you kind of have got that comprehensive rejuvenation that's going to last you 20 years.
Let's take a break, and when we come back, you mentioned something earlier in the show, mini facelift. Let's talk about the mini lifts.
Yeah, neck lifts too, and some of these other terms that get thrown around. What do they mean?
All right, we'll be right back with more of Look and Feel Your Best. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty, Medical Director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. And I'm Gina Birch, and we're talking about the facelift and what it is actually. And Dr. Flaharty's been defining it in great detail and hopefully helping some of you who are listening overcome maybe some misconceptions and perceptions, changing your perception on what a facelift is.
Yeah, I think it's helpful to define it because it is, it is an evolving topic because the techniques are changing and evolving. As we just mentioned, the endoscopic brow lift, which is small incision, no skin removed, is a very different procedure than an open brow lift. And those are both forms of upper face lifting, but the technology has really changed things. And, in the lower face and neck lift, our technology has gotten better as we understand the tissues better. We have better anesthesia, ways to do the procedure with less risk of swelling and bruising, quicker recoveries. And so it is, like you say, it's not your mother's facelift, I mean, it's a it's wonderful when I have to do these procedures and patients have like no bruising, and not everybody gets by with that, of course, but
nice.
but yeah, it's great when you see them day one, they look great, and 2 days later they're out, out to dinner with their spouse or friends. I mean, that's wonderful, and that can be achieved. I mean, that happens a lot, So again, based on what we're doing and the amount of procedures, and downtime can vary, of course, but almost everybody's out socially by 2 weeks, and so it's kind of in that range of when techniques get better. But one of the things I did want to address is just because the terminology is the part that becomes so confusing,
right.
And there's a lot of different names for a facelift that people use to market, a particular. It's really just a marketing tool when people talk about different terms for a lift. But a mini lift, for example, is it's a powerful marketing tool because people are like, well, I don't want a whole facelift, but I could do a mini lift.
Yeah.
I hear this all the time from patients who I see who are coming in to talk about rejuvenation and have had a face and neck lift, but they say, oh, well, I just had a mini lift. And then you look at, the incision lines, they had a full face and neck lift, but in their mind it was a mini lift.
Right.
So it was something that they makes
them feel better about
feel comfortable about it. But a mini lift, though, really, again, when we define it, is really something that's a lesser version than a full face and neck lift. So what does that mean? Well, typically it would mean the incision lines are smaller. So what I call our version of a mini facelift is what we call an S lift, and that's kind of defined by the shape of the incision, and that's an incision that starts in the hair in your sideburns and goes inside your ear. So again, there's no line in front of the ear, and then loops around the ear lobule, but doesn't really go up the back of the ear or into the hairline. So it's really not a neck lift. It's just more of a facelift. And when I say that, you're sort of lifting the tissue in front of the ear and along the jawline. And when you do that, you can tighten up the face and you can tighten up the jawline, and it will even tighten up some of the anterior neck as well. And you've limited the incision, and so there's less swelling, less bruising. Certainly nothing really is happening in the neck because you're not dissecting that out. And so, it's quicker recovery and less downtime. But it's not really an appropriate procedure for the majority of patients I see, because most of them have a lot of laxity of the neck and really need a neck lift. And so
that's what I was thinking. Who would this be good for? Just maybe someone who's got a little bit of the jowling and want to lift? Or
exactly. Somebody who might be in their early 40s and have a little laxity of the jawline and may be interested in a lift. And nowadays we have a lot of non-surgical procedures that are kind of competing for that patient now, like Ultherapy, or even the Instalift, which is the absorbable thread lift that can give you some nice tightening and probably last a couple of years. And so we have some technologies that are non-invasive or minimally invasive. And so I think these mini lifts are less popular now because there are different ways to do it even less invasive. But for the right patient, it can be very effective. If you just have some laxity of the cheek, and then doing these S lifts are nice. They're a quick procedure, really minimal downtime. I mean, people look good the next day and can be functioning pretty normal within a couple of days. So it's really a nice procedure.
And you still need a little bit of sedation for that too, right?
You do. I mean, I do everything with sedation because I just think it's the better way to go. People are completely comfortable. They don't feel anything. Right. And, you could do it in your office without sedation, but the patients are going to feel that when you're numbing them up. And most people would prefer to have, a little bit of IV sedation. I mean, again, that's state of the art. We have great anesthesia techniques to keep people comfortable. That said, pretty much all the procedures we do, even if we're doing everything on the face, that's still IV sedation. We're not using general anesthesia. So it's another big advance, as we have the ability to keep you very comfortable without putting you under general anesthesia. You're just in a twilight anesthesia while we do the procedure. It's a safer way to do it.
One of the things that we haven't really touched on yet, and you kind of did, you mentioned it briefly, is when we're doing this harmonious rejuvenation, there are other things besides just the endoscopic brow lift and the lower face and neck lift that come into play to make everything fall into to place and give you that nice three-dimensional look.
Right. So an endoscopic brow lift would lift the upper third of the face, the forehead, the upper eyelids, and even down through the crow's feet into the cheek area. Lower face and neck will help start from the cheek and lift down, including the jawline, neckline, and all the way down to your, Adam's apple and even further down to kind of the clavicle. I mean, the neck lift will tighten all that tissue all the way down to where your necklaces hang. And that's, very, very powerful. But those two things can give you better shape to the face, but that doesn't address the volume loss. So much of aging is a result of volume loss, fat, and your bones even resorb and shrink. And so adding fat back to the face can create, or fillers, but fat is the surgical way to do it. We harvest the fat from your abdomen or flanks. We spin it down in a centrifuge. We concentrate those fat cells, and we layer them into the face to rebuild the face to its more youthful shape. And the areas where you see that the most as we age would be hollow temples, dark circles under your eyes, flat cheeks, that middle third of the face. Adding volume can restore that. It's not just lifting, but lifting and filling so that we have a more youthful shape. Because as we mentioned at the beginning, facial rejuvenation isn't a matter of lifting and tightening. It's really creating a youthful shape. Mm-hmm. And a youthful shape is soft and full, but not tight, not stretched. Mm-hmm. And so volume is a great way to do that because it gives us that filling, the full temples, the full brow, the full cheekbone, and strong full jawline, as well as fullness in the mouth area, so we don't have the hollowness or deflation or some of the flatness of the lips area. So fat augmentation is that third dimension, and it's something we add a lot to our face and neck lift procedures because that gives you so your own fat is sort of the perfect filler because it's living tissue. So the fat that survives will be there for many years. It's soft and natural. Of course, you're replacing the fat you've lost with your own fat, so it's the best substitute. Mm-hmm. And it really gives you that sort of more youthful volume that makes you look just healthier and younger. That's
been one of those huge advances that you were referring to is being able to fill like that and more importantly use your own tissue, which also has the added benefits of having stem cells and helping the healing process along a little better too.
Exactly. So when you spin down fat, you get a lot of growth factors and stem cells in that plug of fat, and that actually helps all the tissues heal faster and look better, including the skin. So it's a really great procedure. So I think, endoscopic brow lifting has been a huge breakthrough in terms of upper face rejuvenation. I think fat augmentation, it was the next big thing, of our modern time in terms of reestablishing that more youthful volume to the face. And that is going to continue to get better and better, but is a very important tool for giving us, again, our best results are patients who've had fat with a facelift because they not only have, great shape to the brows, jawline, neckline, but a youthful shape to the face because they don't have the hollow temples. They have nice, full, youthful cheeks, and dark circles are better, and it just lifts and fills the face, and it helps keep the face looking younger for much longer than, we used to do facelifts without volume before we had volume, before we had fillers and fat. And those patients were always the first to kind of come back and go, oh, well, gosh, things are sagging again. And that's because they just didn't have enough volume to hold the face up.
Makes sense.
So, the jowling would start to come back, the laxity in the neck. So when you add that volume, it not only makes them look a lot younger and healthier, it helps maintain the face in a more youthful shape much longer.
Another thing that is kind of like an add-on procedure, if you will, when it comes to facelifts is, so you've lifted, you've tightened, you've filled it back up with volume, but man, my skin still looks old. It still looks sun damaged. Now it looks better. My face looks great, but I've got just sun damage. It's just what can you do for that as well to really knock it out of the park?
Yeah, so laser resurfacing has continued to get better too, and again, that was very popular in the 90s, and some of the early lasers, which were fully ablative and pretty aggressive, took a long time to heal from, although they tighten the skin very well. But the fractional lasers we have today are much gentler. You can get great wrinkle reduction, get rid of that sun damaged skin, and make the skin tighter, smoother, and softer. And because because these are gentler and less heat and quicker to heal, you can do them with a facelift safely, which is really the key thing. And so now we can combine skin rejuvenation with the lifting. So you do the, brow lift, face and neck lift to, tighten the, lift and reshape the face. We do the fat to add the volume, and then use the laser to tighten the skin. And that's really the state of the art for just a comprehensive, knock it out of the park, complete rejuvenation, which is great. I did want to, before we finish, because I know we're coming down the home stretch, mention neck lift, because that comes up a lot too.
Okay.
And isolated neck lifts, typically what will happen is a patient has had a face and neck lift, and 10 or 15 or 20 years later, they'll notice that the neck has loosened up, not to where it was before, but there's some laxity there.
Right.
Those are the patients that, I most often do neck lifts with. And that's a procedure that's growing in popularity, because what we can do is we can do a neck lift to tighten the neck, and then often I'll do fat augmentation to replace the volume in the face, and maybe a laser. So we've filled the face to add the volume, we've tightened the skin, and then we've tightened the neck by doing a neck lift. But they don't need a facelift again, because the volume and the laser is enough to tighten it up. They don't need a full facelift. So we're doing more and more neck lifts, but that's typically in somebody that's already had a face and neck lift, where the neck will loosen a little quicker than the face because of the amount of movement of the neck. I mean, it's very, very rare that I ever do a neck lift as a primary procedure, because almost everybody that has a loose neck has some looseness of the jowling and face too. And so the best way to do it is to do the face and neck together. And
right.
Sometimes I think people trying to do more through a smaller incision only handicaps yourself. So you really need to do the appropriate result. Sometimes you have to make the more full incision, but you get a better and longer lasting result.
Good. Well, if you want to learn more, even more than what we've already told you about with the facelifts and just what's going on at the Azul Cosmetic Surgery and Medical Spa, you can look it up online at Azul, A-Z-U-L, azulbeauty.com. You can give Dr. Flaharty and his office staff a call at 239-415-7576. That's 415-7576. And you can keep listening to us every week.
Every Saturday, absolutely.
Well, it's good to see you. Thank you so much for all the information this morning.
Yeah, good to see you too, Gina. You have a great day.
I will. We'll be back next week with more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch.